because of CAR T. This is the miracle therapy, the miracle drug, the life-saving drug, the curative cancer drug that everyone has got very excited about. And Immuneel has brought this drug to patients in India in a very accessible, affordable way. Because these kind of therapies in the West cost $500,000 to $1 million per patient. And here, of course, it costs a fraction of that. And that's what is very exciting for us as scientists, us as a startup company. We have now treated about 50 patients, and it's very nice to see that a large number of these patients have responded very positively and are in remission for a long period of time, and we consider such patients as cured. So that is the power of these technologies. And we want to basically develop more and more such CAR Ts for different kinds of cancers. And I think the team at Immuneel is very, very excited, is very capable, and is developing a very, very powerful pipeline of products that I'm sure will really, really change the way we look at these cancers. So with that, I would like to say that as a co-founder of Immuneel, I'm very, very pleased and proud that we have advanced so much in such a short time with such world-class capabilities and with such great world-class outcomes.
To bring a global standard product, CAR-T product to India. And we are the first company to have seen amongst the patients we have treated. Kiran ma'am was mentioning that we have treated 50 patients over the last few years. There are 7 patients who have crossed 2-year progression-free survival, which is a national first for Indian CAR-T therapy. Why is this so important? It is important because of few reasons. One is, cell and gene therapy is the next frontier of medical science. In India itself, there are 70 million odd cases due to genetic disorders which are quite untreatable right now. And innovations such as what we are trying to do will provide hope and treatment for such patients. Every year, close to 1 lakh patients get blood cancers, and many of them would get treatment with therapies such as CAR-T therapies for non-Hodgkin's lymphoma, leukemia, and multiple myeloma, all of these 3 programs that we are working on. Lastly, ma'am mentioned a very, very important point. This therapy is personalized therapy, which means that treatment is created with the patient at the center, which means we have to work very, very closely with the hospitals, with right standards, with right safety standards. We have been the first company in India to create an accreditation process where we have accredited 50 plus hospital chains across the country to be able to provide cell and gene therapy, which means we are building an ecosystem for the nation to provide cell and gene therapies to patients. And with this network, we are closely working with these doctors to train them, provide them safety standards, and have created a global standard logistics model to actually treat patients. One of the studies we did, we found out that a patient travels 400 kilometers today on an average to actually take CAR-T therapy. That is the access that today the country has. We want to remove those 2 zeros. Why should the patient travel so far? Why can't CAR-T therapy be accessible to the patient where he or she is? Millions of dollars are spent by patients across therapy banks. Why should they spend millions of dollars? We want to be the pioneer for the world in actually showing that this therapy can be done at scale and at a fraction of the cost. We are already providing therapy at 10% of global cost today. This is the Independence Month, and I also wanted to share that we have launched a campaign called Azadi Lymphoma Se, which is really independence for patients who are struggling with lymphoma and who had no hope, where with CAR-T therapy they can get hope to be free from lymphoma, which is a killer disease. Thank you, and we'll be happy to take questions.
Sir, what are the latest results for the clinical trials you have been using?
So the way you have to look at results actually is at time points of days and then what is called response rates where we do scans. So we have seen benchmark response rates of 83% with ORR, what we call overall response rates at day 90, and 50% complete remission at day 365, which means that 1 out of 2 cancer patients from a long-term survival basis are cancer-free for the lymphoma CAR-T that we have.
Sir, what type of cancer was targeted in this? Imagine phase 2 trial.
It was non-Hodgkin's lymphoma, which is an aggressive form of blood cancer,
So what are the
and
criteria?
leukemia.
What are the criteria for this?
Criteria, you have certain requirements in terms of selecting patients who have these diseases and that they have exhausted all other treatments and they are now coming to a final stage of what is possible. So these are patients, when you do a trial, that they have these diseases like leukemia, lymphoma, and they have tried other treatments, the usual treatments that they try, like chemotherapy and bone marrow therapy, and yet they are still not, it's still not working. So they still have the cancer and it's advancing. So with such patients, when you come and give CAR-T and then it disappears, it is like, that is what is very exciting. And like I explained to you, these patients are very, very compromised patients in terms of spreading cancers in their blood. And you take their blood, you take T cells which are not working in their blood, make them work again by engineering them so that they become really powerful, and you put it back into the patient's blood. And then those T cells start looking for those cancer cells and kill them. That's the power of this technology.
What is the course of therapy?
What's the course?
Yeah.
Alex. So as ma'am mentioned, this is basically for relapsed patients, right? So the way it works is that it's a personalized therapy. So there is something called an apheresis process where the blood, they take the blood, and these hospitals that we have accredited, those centers actually take the blood. And we ship the blood to our manufacturing facility, which is based here. Then we basically work on culturing the blood and infuse what is called a viral vector to generate an immunity response, so that the blood becomes actually the medicine, right? So once that is created of a certain volume, then we harvest those cells and we ship it back to the patient, to the hospital, and then the infusion happens into the patient. Now what we've also done, which is also a very unique first in the country, is what we call fractionated dosing to manage the response. So we actually infuse the blood in fractions, 10%, 30%, 60%, over the week, 10 days, while the patient is admitted. And post that, so it's one set of infusions, which is fractionated, and then the patient is discharged in about 2 weeks. And then we follow up.
So maybe you should say that process of taking the blood, the apheresis, and then converting it, engineering it in our labs and expanding it in our labs takes about 2 weeks, okay? And then you give it back to the patient. So the whole process can take 2 to 3 weeks. And then the patient goes home. And that's it, one shot for the life.
Any follow-ups are done for this?
Yeah. You have to do follow-ups in the sense that, obviously the doctor who's treating the patient will definitely ask the patient to report anything that they feel, those kind of things.
So the follow-ups are done with respect to immunity, any kind of other secondary infections, any toxicity. But as ma'am has mentioned, the infusions will be one time. It's not that every month, like other cancer therapies or immunotherapies, you're taking injections or medication, right? The medication is once.
Any trials or treatment given in India?
So that's what we were mentioning. We've treated.
But this is all India. Yeah? Why do you think it is somewhere else?
We've
This
treated.
is all in India.
So since we have started, we have treated close to 50 patients already.
Sir, this is like stem cell therapy?
No. Stem cell therapy is different. This is cell therapy.
Okay, what are the common side effects and how safe is this?
This therapy is extremely safe with respect to how it is done for the patients. Of course, there are certain qualification criteria, screening criteria which we follow while we are creating the eligibility for a patient to take this therapy. There is something called the cytokine release syndrome, which is basically toxicity-like effects that come in high-grade fevers, other infections, immunity.
Like what you got in COVID.
And then there is something called ICANS, which is a neuro side effect. In our case, I mean, for this product, the ICANS is 0. Of
Many
course,
CAR-Ts get this neurological problem, tingling of your nerves. Many of these CAR-Ts have it in the world, but ours has 0.
but with respect to the CRS, which is what is typically even what happened in COVID, there is a way to manage it, and that is managed while the patient is in the hospital when the infusion is going on.
What are the chances of relapse?
There will be chance of relapse. Not everybody gets 100%, but like he said,
50% is complete remission, 83% has been the response rates, what we have seen. So 8 out of 10 patients are responding to the treatment. And then what happens is, as we see over the long term, we are seeing in 50% of the cases, 5 out of 10, long term, the complete remission is there.
Again, they can go for this same therapy.
It's only one infusion.
Only.
They don't need any more injections or any more therapies. So that is the beauty of this treatment and the innovation that is there.
Sir, can you disclose the cost of this treatment?
So today, again as ma'am was mentioning, this costs about 4 to 5 crores globally. In India, to the patient, the cost comes anywhere between 50 to 70 lakhs, right? Which means cost of the medication, cost of the hospitalization, other charges that, because it's a package which the hospital actually takes, including our cost, right? From our perspective, depending on the patient and depending on the shipping and logistics and everything else, we price it between 35 to 45 lakhs, which is 10%, as I mentioned, of what is being offered globally.
Sir, are there any ongoing or upcoming trials for other cancers using this therapy?
Yes. So we are currently completing our trial for leukemia, and we will soon be able to offer the therapy for leukemia as well, which is again an aggressive form of blood cancer. One more form of cancer is multiple myeloma, which is really aggressive, right? And there is currently very limited treatment available in India for multiple myeloma. We have now launched our trial for multiple myeloma as well, and we are hopeful that in the short term we'll be able to provide for a similar CAR-T therapy for multiple myeloma to patients.
Sir, what is the success rate, sir?
very good. I mean, he's just told you.
I have told. Again, I want to.
Let me put it this way. Many of the patients who have come to us have exhausted all options. Many of the patients who have come to us have only 8 to 12 weeks who have been told by the doctors to survive. Right? 83% of them have responded to this treatment. 50% of them over the last few years have actually seen complete remission from that cancer.
You know, you should speak to that patient. Rather than asking us, what is it? You should speak to a patient who has survived for 3 years, and he will tell you that when he came for this trial, he was so weak, he had given up hope, and his doctor had told him you only don't have more than a few weeks to live. And he came and took this treatment, and today he won't even think he had cancer. He's such a healthy person, he's doing his normal job, and he's very sad. He had tears in his eyes. He said, I'm standing before all of you because of Immuneel. 3 years later.
Doctor, which stage is perfect for this therapy?
This is relapsed patients who currently, what has happened is, because it's a novel therapy.
Do you understand what is relapse? When a cancer patient comes, you treat that cancer patient, then the cancer patient might respond for a few months, then again the cancer comes back. That's called relapse. So these patients have had multiple relapses. He was telling us, he said he had his cancer he had in 2020, and he said it was aggressive. Then they gave him a treatment, I think chemotherapy. It went down for a few months, it again came back. They treated him again. I think they gave him bone marrow, I'm not sure. But they gave him some other treatment. That also he only responded for a short while. Again, he took his treatment in 2022. So in 2 years' time, he had multiple treatments which were failing. That is called relapsing. So finally his doctor said, I don't have any more things to treat you with. Now, God is going to decide how long you will live. That is what he told the patient. Okay? Now I have no more options. I've run out of all the treatment. So now your cancer is aggressively growing and you have maybe a few months to live. Okay? That's when someone told him, why don't you try this treatment? And he came to here to Dr. Sharad Damodar. And he said to Dr. Sharad Damodar, I was told to contact you. So Sharad Damodar said, yes, you should get into this trial. And he treated him in 2022, July. And today is 3 years later, he is completely healthy. So you can understand what this drug does.
Sir, after this,
From root level, you're cured, right?
Huh?
Absolutely.
From root level.
Yes, it is going to get cured completely.
So this person is completely cured.
He has resumed his normal life.
His normal life, he went to Nepal just now
Yeah.
and came back.
No
He said,
need of following you.
nothing.
you are not even going to keep him for the observation.
He was observed in the first few months. No? After that, once he's cured, you don't need to do anything. Only if he has a problem, he'll come. But he's had no problems.
No.
But as a cancer patient, in the past, obviously once a year he'll do some checkup. No? He will just want to, as a safety thing, he'll come for a checkup.
The person does not need to be in the hospital. They can lead a normal life. The person, of course, will undergo checkups. The person does not have to be on long-term cancer medication like monoclonal antibodies, MABs, etc.
See, he doesn't need any more
Nothing.
medication. You just think about it. Today, if I'm a diabetic, I need to take something every day, every month, right? To manage my disease, right? Even if you're a cancer patient, my late husband was a cancer patient. I had to come every month to give him a treatment in the hospital. But this person, he has taken one treatment in the hospital. Now he doesn't have to take more shots. He doesn't need more pills. He doesn't need more injections, nothing. Just think about it. That is the power of cell therapy. It is a very new kind of cancer therapy. That is why everyone is so excited. And it is very complex. Don't think it is some simple thing. All of you should understand how these cancer therapies work. It's not some tablet that you give, and even those tablets are very complex. But I'm saying it's not like you're swallowing a tablet. This is a hospital therapy. Have you seen bone marrow therapy? What is bone marrow therapy? Then the bone marrow therapy also is another kind of therapy that they give to some of these cancer patients. So there the patient is kept in a room, their whole B cells are depleted, then they are kept in a sterile room, and then they are basically given the healthy, all the bad cells are destroyed, killed. They are given medication, then they are given a new, like what you said, that stem cell. It's called a bone marrow cell. So a new cell is given from another donor. It's given. So that now when the bone marrow produces new cells, it will be the healthy cells. That is a very long process. But this person even went through that. And that also failed. And then you're giving him this treatment and it's curing. So you must understand that a cancer patient does a lot of things. Right? So all the time you are worrying whether your cancer will come back, your cancer will come back. So these are the very advanced therapies. So if any of you have in your families or friends who have these kind of problems, these are the new ways of curing it. Otherwise there is no hope. You have to undergo years of, like my husband, for 15 years he had to undergo a lot of treatments and then finally he died. But he had to undergo a lot of treatment. So I'm just trying to tell you, if you know what cancer is and if you treat a cancer patient, you will know how difficult it is. So the questions you're asking tells me that you don't understand how cancer patients suffer.
No, they does not like that. We just
No, I'm just saying. I'm not saying anything. I'm just saying if you understood what cancer patients go through, then you will know what the power of this therapy is. But if you are not familiar with how cancer patients are going through all these problems, then you will wonder what is this, what is that. You know what I mean? So the question he asked, how is it relapse? Yes, this patient who are being treated have tried out different treatments and they are not working. As a cancer patient, you feel, what is happening to me? Why is it not working? Why have I still got cancer? See, when you undergo with a cancer patient, that is the biggest problem in their mind. My husband also, every time he would come for a checkup, he'll say, oh, do you think I'll be okay? Do you think I'll be okay? That is always psychologically worrying you. Now to be told that you are cancer free is the best news a cancer patient can get, no? Otherwise they'll say, no, your cancer is under control. Yes, you are responding to the treatment. Yes, you're okay. And then suddenly when you see that there's no cancer in your body, isn't that fantastic news? That's what I meant. That, if you look after a cancer patient, you know how worried they are.
See, and this therapy has been there. 2012, the first patient in US got treated. Today, close to 50,000 people across the world have got this therapy. We have brought this to India because otherwise, what would
Other Indian patients cannot afford it. How can we spend 4 crores per patient? Can't. Right? And you can see, only 50,000 patients around the world have been treated with this patient. We want to do that 50,000 in the next few years in India. So, that is what I think you should understand what we are trying to do. Because even in parts of the world, they can't afford it. No matter how rich the country is, you can't keep affording to pay that much money for a patient. And the beauty is that the first patient who was treated in 2012 is still alive and doing perfectly cancer free. That is the beauty of this treatment. Emily Whitehead was the name of this young girl. I think she just got married. She came as a child and she was treated with this CAR-T therapy. And today, she's 23 years old. And she's alive, she's normal, I think she just got married, she went to college, university, everything she did. And if she didn't have this treatment, she was going to die in a few months.
Any age limit is there, sir, for this? No.
That is the beauty of these treatments. See, your cell is so powerful, right? If something goes wrong with your cell, you will get cancer. If something goes wrong with something in your body, you get some disease. So you have to know how to correct that cell.
See, one of the most important things in diseases like this is quality of life. Right? What CAR-T gives you is quality of life. Because once you get this infusion, and if your body has responded, then you can go about your life. You don't have it at the back of your head, what if?
That's what I said, the psychological factor does not allow you good quality of life. Plus your cancer itself makes you very weak. The moment this person I was seeing this morning, normal, healthy person. And he was telling me, ma'am, you should have seen me when I had cancer. I had lost so much weight, I had no energy, and I had no hope. That was his words.
Sir, you said that 8 out of 10 are getting successful in this therapy. So how about this 2%?
What is the
Why
reason?
it is getting
Yeah, but please understand, in everything,
No, at what part of thing they are getting failure? Means,
no,
because
it depends
of
on,
their
see,
lifestyle.
please understand, a living system does not respond in the same way to everything. Even if you're a diabetes person, okay, and you're taking one medication, some people respond very well, some people don't. Why? Because your system is, you can't tell what is happening in your body when you have cancer. Supposing you have multiple other things that are apart from the cancer. See, there are what they call comorbidities. Like apart from cancer, you might have many other diseases. Then when you give this, you may not have the same response as somebody who has a different kind of health condition. So it all depends. It's an individual thing. That's why it's called personalized therapy. Today, any medication. See, I'll tell you something. I'll give you an example. Everyone takes a sleeping tablet if you can't get sleep. Right? Some people it suits you very well. If I take a sleeping tablet, I cannot take a sleeping tablet because it does not suit me. Next day I feel very drowsy. Lot of people say, oh, this is not drowsy, this is not drowsy, but it is drowsy for me. So my body reacts in a different way than yours. You understand? So like that, even this cancer therapy, the fact that 80% of 8 out of 10 patients is responding to this treatment is great. By the way, when you do a clinical trial, you know what is the end point? If 60% response is good enough. That was what we went with. When we went for this trial, the drugs controller said if 60% people respond to this CAR T therapy, we will pass it. But here in our case, more than 80% responded. So it tells you what the expectations are. So when you do a clinical trial, nobody expects 100%. That's why it's called a clinical trial. Because you know that each patient is different. But you're giving this thing saying, okay, let us see how these patients respond. So according to us, 80% is global standard. If you look at the global data, to get 80% response is very high. Many global trials is like 70%. We are in that 80 to 90% range, which is very good.
Actually, we have got a global standard product.
In fact, our product is global standard. So, you know, when you talk about clinical trials, no clinical trial will give you 100% response. Any trial you do, forget cancer, you do any trial. If you get 60% response, it's considered to be very good.